Alrighty, let's get started today. We've got a lot to get into, so we're going to start out taking a look at some research tools, and that brings us to consensus. Alrighty, let's take a look at some quite useful research tools. And I believe all of you have a research project. Now, things are changing rapidly. So, here is an extremely valuable application. Okay, and our topic for today, just off the top of my head, pollution. And let's take a look at PM 2.5 and health. Now, this research tool is called Consensus App. So you can utilize it in a limited sense, and I don't know if you have access for a free pro version of this. Let's go to their website here. Let me double check. Yeah, let's go. It's called Consensus App. And if you type in consensus, be careful that you don't go to the wrong place. Sometimes these Google sponsored results come at the very top. And there it is right there. It's called Consensus AI, and the URL is Consensus App. It's a little confusing, but not very. It's quite simple. You see this green logo here. Click on Consensus AI for research. And okay, I'm logged in with a pro version. You should be able to get limited pro version. Let's continue. All right. Now, just for the sake of conversation for this particular class, here's an idea for research. And this is extremely useful for English language acquisition. My question or query or prompt for consensus is all about academic research. So it's an AI tool that is focused on academic research and papers, and it will not give you other types of sources. It's all focused on journals and research. Extremely useful for medicine. My prompt: identify the top 10 most important issues being researched in pediatrics. So we'll take a look at pediatrics today, and I think we have quite a few pediatric residents. Now, it's just for demonstration purposes only to take a look at pediatrics. We could use orthopedics, and I got a few worksheets for these specialties, but the goal really is to improve your English language fluency and your critical thinking skills. Let's continue and take a look at the results. So, consensus, in a matter of seconds, identified several, 10, I asked it to find 10 interesting issues in pediatric medicine, pediatrics. And so it listed the top 10 in its research. And again, AI can be completely wrong, But I think these results are very useful. And so rather than searching with Google or Google Scholar, this makes that redundant. This is much more powerful than Google Scholar. Yeah, it may make some mistakes, but I don't claim to be an expert either. I've been using it for maybe a year or so, but I still don't claim to be an expert. And we'll take a look at some other tools that are somewhat new to me. They've been around for a little while. All right, this is a little bit different than ChatGPT, and I'm not going to get into all of the details or claim to be an expert on any of this. Once again, I'm not a medical doctor. My degree is in dental medicine. So I am a health professional by training and have knowledge of much of the basic sciences, but it's been a while since I've studied the basic sciences, so don't count on me for expertise in medicine. We'll focus on the English, and all of this is for the purposes of acquiring or improving our English usage. So let's just take a look at it, and as I speak, you should be able to get some pronunciation tips. I'm not sure if I'll be able to get closed captions, subtitles for this video. Anyway, let's take a look at the results, and I think they're really spectacular. Infectious and emerging viral diseases, allergy, asthma, and immune-mediated disease, neonatal care and preteen birth, neurological and mental health disorders, nutrition, child behavior, chronic conditions, pediatric pharmacology, methodology, technology, AI telehealth. And that's a fantastic area that I haven't really explored that could be extremely interesting. I don't know how your research projects work at your faculty, but I believe you're all responsible for a research project. Check, I might be wrong. And this continues to do extensive research, and it just works on its own to gather sources related to a variety of different issues here. It organizes it into these very nice visual tables and has links. Let's see if not all of the links will work. Some of our research papers are behind paywalls and require a subscription. And Rajawati should have a large yeah, here we go. And this is downloaded, an Italian Journal of Pediatrics. It's in English. So if it's behind a paywall, I don't believe the consensus can give it to you for free. So there are some limitations always when we're talking about research publications. Okay. Now my next question was, is there currently any research aim or projects or papers in the area of PM 2.5 and pediatric health? And yeah, we've got a host of relevant research done on pediatric health, PM 2.5. Don't really know whether you're doing anything with this, whoever residents in pediatrics, but anyway, this research tool's pretty amazing. Yeah, you can do it with Google Scholar, but this is really amazing, and it gets it organized and puts it in a visual way so we can see major research themes in PM 2.5 and child health, and then so it's narrowed the original focus from issues in in medicine to issues in pediatrics to a focus on PM 2.5. How did I get there? I don't know, just thinking about we have all these flags at Mahidol University for air quality related to PM 2.5. And don't forget the app on your phone. I don't know if I'll be able to spend much time on this, but there are many, many useful applications on our phones that can boost our English speaking skills and the use of English in medicine and also critical thinking. I'm not going to talk about them today. Let's see if I can just show you one app on my phone right now that is extremely useful. I use it to look at Thai and English. You can't really see it very well. I'll share it next time, perhaps. I'm not really prepared to do this, but it's called OWLL, OWLL translator. And I'll see if I can provide a link for you this time or next time. What's useful for me, and you can reverse it, if I'm listening to Thai news, my Thai understanding is limited. This captures the Thai language and prints it up on my iPhone in Thai language and also in English with a translation in English in almost real time, which is quite amazing. So you could be watching TV in English and it should be able to translate it for you into Thai. It can do some other cool things with your voice. In fact, it can take your voice. I've done this, recorded a small sample of my voice, and then it will translate it. It will be able to speak Thai language with a voice that it is generated from my voice. I don't know how great it is, but it actually, some of the small things that I've done with it sounds pretty darn good. So anyway, there's a lot of amazing tools at our disposal. All right, let's continue with a look over at the research, and there's a variety of papers that this application has accessed. So again, we're talking about Consensus app. I think you can see that in the browser. Let me double check that. Okay. There you go, right there, Consensus app. Conclusion. Yeah, PM 2.5 and pediatric health. Active, mature research field, strong evidence for harm in a lot of different ways for pediatrics, as far as, pediatric health, respiratory, cardiovascular, neurodevelopmental, overall developmental health, and a growing work on specific components, sources, vulnerable pediatric subgroups. And it continues to find more and more. There's like an unlimited amount of journals here. And so I've done another search related to this. I will click on one of the papers that it found. This is, I just opened this up, the Italian Journal of Pediatrics. Found another one that looks useful with a lot of citations. Air pollution and children's health, a review of adverse effects associated with prenatal exposure from fine to ultrafine particulate matter. And let's take a look at this one. This is published by BMC, but it's Environmental Health and Preventive Medicine 2021, but relevant today. Let's see if we can find PM 2.5. Yeah, PM 2.5 comes up 159 times in this journal. So it's quite relevant for PM 2.5 and children's health. Here's a more limited thread that I continued with. I just opened up a new thread in Consensus, click on new thread, and then I just asked it to research PM 2.5 and pediatric health. Now in Thailand, not in the world, but in Thailand, and just to see if there's anybody doing research here in Thailand. And yeah, and it summarizes what it has found in a very visual way, easy to understand. Find particulate air pollution, burden, exposure, vulnerability. I don't want to spend too much time on it because we got a few other interesting things to do. It's captured a lot of information and a lot of papers. I mean, much more limited than in the world. And this issue, pediatric health and particulate matter, but it's captured a host of papers already, like 20 of them already related to this matter in Thailand. We can click on load more results, and we've got more and more results. That's pretty amazing what kind of results we've got here. All right, now an incredible other relatively new tool is Notebook LM. I was introduced to this months and months ago. I looked at it and I saw some interesting things. Here's another paper that it located in relation to this issue in Thailand. Future health risk assessment of exposure to PM 2.5 in different age groups of children in northern Thailand. And this would be Payao, Department of Environmental Science. Yeah, it's all northern Thailand. Keywords right there. So I strongly recommend Consensus over Google Scholar. You can see this study, and it's apparently open source, so it's not behind a paywall. We don't have to pay for it. There are ways to get around that, but I'm not going to bother with that right now. Now, okay, I put all this information into this very useful tool, Pediatric Health, right there. Okay, I put the links to the 2 Consensus searches there, and I put these 2 journals in there. I believe it just summarized these journals. I don't claim to be skilled with this, but there is some amazing results here. So let's take a look at it. I've created this notebook, and I'll share it with you with a link. Make sure you can. Okay, it's a Notebook LM notebook that I will share with you. And I believe it will work. I'm going to open up another browser right now. Well, I'll do that later. And I'll share this link with you. Okay. All right, let's continue and take a look at this notebook. It's a summary of all that information right there. And then you can, it actually puts up some potential questions you might ask about this issue. How does prenatal exposure to air pollution affect childhood health? And it will answer in detail. And then I asked it to do some, I just went through some of these questions here, just clicking on them. How does prenatal PM 2.5 exposure affect a child's long-term health? It's really pretty amazing. It's found sources and info, science, facts related to this, all from research, cardiometabolic health risks, etc., etc. I believe you'll be able to see this in this notebook, but you can now interact with this notebook yourself. It may ask you to log into Google to access this, but I strongly recommend it. There's a lot of useful information here. Now, in addition, and I don't claim to be an expert with this, but it can create a variety of different products that you can learn from. It created a video in a matter of seconds. I'll play this video. Wait, let me make sure we got sound on this.
Makes them so dangerous. See, they're so small they can sneak right past our body's natural defenses, like the filters in our nose. They can travel deep. Welcome to The Explainer. Today, we're diving into a threat to children's health that's hiding in plain sight. We're going to break down how the very air we breathe can have these huge lifelong consequences, especially for the youngest and most vulnerable among us. And this question really gets to the heart of it, doesn't it? The danger we're talking about, it's not some obvious chemical spill. It's in the air, it's all around us, and it affects millions of kids before they even take their very first breath. So what is this invisible culprit?
All right. It just went ahead and created this video overview, and I'll scroll through this. And
Guys, their organs are still growing.
It looks like it's really valuable
and developing.
In discussing this with a patient. So I'm sure there are ways that this could be revised or modified. And now let's take a look at some other. It created a sound file, audio overview of this. I'm not going to play it. Risk assessment. Let's take a look at this one. Health risk assessment of pediatric 2.5 exposure in Thailand. And it's created a detailed chart in the form of a PDF that can be downloaded that spells out a variety of information related to this particular issue. So this is pretty good content. I don't claim to be an expert, so you may look at this and say, no, it's not. But anyway, this is magical in my opinion. I think we can download this PDF. Yeah, we could export it, but I'm not going to bother with that. Now, once again, you should have access to this, and I think you'll find this interesting, I trust. What is this? This is a infographic. So it's made it really visual. I got a full screen or larger screen. That is pretty amazing. Okay, it's a one-page infographic. And I don't know how in the past you would create this. You would have to hire someone to do the artwork and to visualize this, but it really looks useful. It could be just converted into a pamphlet for patients. And I believe it could do this with Thai language. So maybe we could test that out. Okay, so summarize this issue in English and Thai language. And I haven't tried this before, so we'll see if it can succeed. English version. Okay, now it's got the Thai version, so it is easily able to do everything with Thai language. And it could be extremely useful for academic research and then learning English, whatever. So pretty amazing stuff. And so there is good reason to believe that you don't have to be an expert in English to be able to write up research. It's a topic that I will take a look at perhaps next week in our next 1 hour session. Yet there are some ethical issues with using AI to do the writing for an individual. So it can certainly ethically be used to revise research. It must be reported. The use of AI, I believe, is now required to be reported in submitting journals for publication. But to use AI to check and revise is an ethical application. I don't claim to be an expert on this, so I could be wrong, but I've explored a little bit about this. And this is pretty amazing because years ago, not so many years ago, people like me were hired to review manuscripts and to edit it. For the most part, AI can replace a freelancer who might be hired to revise a manuscript for publication. I don't believe there's an ethical issue with that. But please do check it out. And I may make, just like AI, I may make mistakes. So I don't claim to be an expert. I've looked at this, but I don't claim to be an expert on this. I gotta believe it's ethical to do that. Okay, let us continue. And I'm gonna share with you another. So that's pretty amazing. And well, I'm not gonna do that, but it could do infographics like I shared with you in English and Thai. But I haven't done that. I'm not sure how to do it right now. So let's go on and we'll take a look at. Oh, yeah, this is pretty amazing. So it took all that information, not a lot of information, but 2 links for Consensus App and then 2 pieces of research, and it took all of that and created this visual aid. So this could be utilized and it could be modified perhaps. I'm not sure how to do that, but this would take hours of work, maybe even hiring someone to create a slideshow like this. It creates it in a matter of seconds or minutes. You can click on these buttons that will create it. Well, you could be doing something else. So let's run through this quickly. I'm not going to explain it all. Okay, let me enlarge the. Okay, good enough. And then, yeah, no, I don't want to do that. All right, let's go through this. Invisible inheritance, pediatrics and pediatric health, northern Thailand. Okay, that is beautiful. And if you shared this in a classroom, the font is well developed and could be seen from the entire room. That is extremely useful graphic of some of this particulate matter, human hair and dust, and all of that. That's a really interesting graphic that it created. And I don't think it's violated any copyright. I don't know. But here we can see maternal fetal interface. That's really, really a nice graphical representation. Now, I don't claim to be an expert, so an expert might be able to look at this and say, no, he's got it wrong. You got this. I don't know. But for the most part, it looks pretty amazing. Now, I don't know how to modify this and correct mistakes. I'm not sure how to do that, but I'm sure there is a way, and things change so rapidly in medicine and in AI that we might be able to look back on this in a few months or a few years and say, well, we got something that's much better to replace that. Okay, let's finish with that very, very nice looking slideshow. Mitigation. That is spectacular in my humble opinion. And conclusion. We are raising a generation with compromised health capital. Intervention cannot wait. Call for action. Okay, that's pretty cool. Let's take a look at the other one. No, the other one, please. Okay, I don't know how to find that. Oh, okay. Here we go. A different version with some different sources, but it's basically northern. Okay, this is just to focus on northern Thailand and PM 2.5. That is really beautiful. Fetal circulation. I don't know if this could be useful to you all or not, but it is really amazing to explain and to describe. And if somebody was giving a lecture, this could be an extremely valuable slideshow. I don't see anything it's doing wrong there. It just really looks vivid and useful. Oh, comes link neuroinflammatory shadow. Some of the effects of this particular matter, anatomy, mechanism, outcomes, autism, perhaps ADHD, cognitive impairment. Again, it's AI created, so take it with a grain of salt. It may make mistakes. I don't know. From what I see, I'm not a medical doctor, so I can't really claim to be able to determine whether this is accurate or not. Adolescence, gender, different seasons in Thailand, prevention, mitigation, diet. That is beautiful. And references right there to those two papers that are utilized. Okay, that's Notebook LM, used in combination with some of the good research done by Consensus App. All right, let's move on. We got a few other things to get into. All right, I've used ChatGPT to create and help me in developing a book. It's based on, but not violating any copyright. I'm not sure if I'll publish it, but this old text, published in Thailand or wherever it's published, it's called What's Up Doc, and it goes through a variety of different situations, different specialties, and it's especially devoted for, it's the purpose is to improve medical doctors and residents and medical students, also to improve their proficiency at English language. So it is Thai English translation, and many different specialties are represented here, including medicine, neurology, surgery, orthopedics, obstetrics and gynecology, pediatrics, dermatology, ophthalmology, ear, nose, and throat, psychiatry, and I don't think we have any psychiatry residents at Rajawati, anesthetics, accident, and emergency. Right here in this book. This book is made redundant by the power of AI in 2025, 2026 here. It was extremely useful not so long ago. Now it's not all that valuable, and I can actually replicate the spirit of this book through AI. So AI has some power, and all right, let's take a look at our PDF for today. Page 2. This is created from ChatGPT, and so it's the idea for this comes from a book which is quite dated that was published utilizing Thai language and English language in various specialties by Dr. Nopadon from Ramatipiti Hospital. And I've created something that is in the same vein. It's not violation of copyright because this is done with ChatGPT, being aware that we don't want to violate any copyright. So let us take a look at this and sample some of the English language, and you can review it with me and check your pronunciation. We're on page 2. It's taken the topic of, or the area of the specialty of pediatrics, and created a worksheet that is extremely useful. You can check it out for self-study, and I've shared this PDF with you for today's session. All right, let's just take a look at some of the conversation areas, and I believe that this is extremely useful. Now, you may find mistakes, you may disagree with me with this. Let me double check my screen. Yeah, I'll adjust my screen here. Okay, let's continue. Hi, I'm Dr. Jones from Pediatrics. May I confirm your child's name and age? Now, with English language, as with any other language, there are a variety of different ways that one could say these and put out this information or ask for information. You could say hey, I'm Dr. Jones, a pediatrician here at this hospital. May I confirm your child's name and age? Who is with your child today? This is polite Thai, parent and patient friendly. I am not great with Thai language, so I am not really skilled at reading this and determining whether it is accurate. You might want to check it out. And I'm sure there are a few mistakes in there, perhaps. If you see anything outstanding, let me know. I would bet that it's quite accurate and useful. All right, let's just focus on the English. But I think the Thai translation is valuable for you. What brings you in today? How long has this been going on? Is it okay if I ask a few questions and examine your child? Is anything unclear? Please stop me and ask. I understand you're worried. Let's take this step by step. Has your child been seen elsewhere or taken any medicine? The word medication could be used instead of medicines. Does your child have any allergies to medicine or food? Food. Is your child's vaccine schedule up to date? Fever. Has your child had a fever? What was the highest temperature? Many other questions related to fever, cough, respiratory issues, cough, cold, breathing problems. Does your child have a cough? Is it dry or is it with phlegm? Any runny nose or sore throat? This is really well done. And this just with a prompt. And I already created a section on psychiatry, and I don't believe we have any Ratchawiti residents in psychiatry, so I created a couple of chapters here related to specialties that I think we do have at Ratchawiti, and this is pediatrics, and the other one we'll get to in a minute. I don't want to spend too much time on this. You could review it and practice pronunciation. All right, there's going to be some tools that we could use to get natural pronunciation. AI is pretty good at this. I'll share more information with you in the next 2 weeks. All right, rash, allergy, skin problems. Does your child have a rash? Where did it start and where has it spread? Any fever with the rash? Has your child had chickenpox or measles vaccine? Any contact with someone who has a rash? Ear, throat, mouth complaints? Is your child pulling at the ear or complaining of ear pain, any ear discharge, and a host of relevant questions? This, I believe, is extremely useful. Urinary symptoms and other concerns, growth, feeding and nutrition, weight loss, poor weight gain, etc. newborn and infant red flags. How many wet diapers today? Any vomiting that is green? Blood in the vomit or stool? Developmental issues. Does your child respond to their name and make eye contact? How's your child's sleep? Explaining the plan, reassurance, and teach back. From this exam so far, your child looks stable. I'd like to do a few tests to find the cause. Natural, medical English in a pediatric setting. I think this is well done. I don't claim to be anything special in creating it. It just took a few simple prompts and the power of ChatGPT. I pay for the plus, but I believe this could probably be done with ChatGPT 5.2 and a free version of it. I don't really know. I pay for the plus plan and it gave me access to ChatGPT 5.2. Return precaution. Please come back immediately if your child has trouble breathing. Come back if your child is too sleepy to wake or becomes unusually weak. Page 7, page 8. All right, some practice activities. Explaining to a parent. Interesting activities. I'm not sure you'll want to do these, but pardon me. Consult karaoke, and I don't really know or understand this, but okay. I don't know. That could be fun. Some glossary: wheeze, dehydration, seizure, hives, street or. I'm not sure I'm pronouncing that correctly because I don't really know that word. Jaundice. I know that word. All right. Now it's created this chapter for orthopedics, and if anyone has any requests, we could create other chapters for other specialties. I'll see if I can do that. Let me just check my timing over here. Great. All right. Language practice, clinical communication, orthopedics. I'm Dr. Smith, one of the orthopedic residents. May I confirm your name and age? I understand you're here because of back problems or whatever. I'd like to ask a few questions and examine you. Is that okay? Is anything painful? Please tell me and I'll stop. Do you prefer Thai or English for explanations? That's interesting. Before we start, are you allergic to any medicines? The better word, I think, here would be any medication, but they're basically the same. Mechanism of injury and pain history. I don't claim to have much knowledge about orthopedics. You may find these questions spot on, or you may say, no, we don't really use those types of questions. I'm interested in feedback on this. Now, Thai translation, from my perspective, I think it's accurate. You may find it's not. Let me know. AI can always make mistakes when you least expect it. All right, there's many questions that could be asked. Can you tell me exactly what happened? When did it happen? Did you hear a feel, a pop, or a crack? Can you bear weight or walk? Where is the pain? Please point with one finger. And with pain, a question that's always valuable: can you describe the pain? Tell me more about it. On a scale of 0 to 10, how bad is the pain? Any numbness? tingling or weakness, any previous injury or surgery to the area. Are you taking blood thinners? And are you taking any medication? All right, let's continue. Focused exam, neurovascular check. I'm going to look, feel, and then check movement and sensation. Please relax your muscles. Tell me if this is tender. Can you move it up and down for me? All right, imaging, X-ray, CT, MRI. I recommend an X-ray to check for a fracture or dislocation. A CT scan gives more detail of the bone. MRI shows ligaments and soft tissue. The radiation from an X-ray is low, but we do avoid unnecessary scans. And it's really valuable to be prepared to explain the any kind of danger. I believe that a few X-rays here would not be increasing the danger or of any real danger to patients when used judiciously. A CT scan gives more detail. The bone. MRI, ligaments. Okay. If you're pregnant or might be pregnant, please tell me. We will explain the results as soon as we have them. ED, OPD, must say lines. Based on your symptoms and exam, a fracture is possible. We need an X-ray. For now, please keep the limbs still. We'll give pain medication and apply a splint. So patients want to know where this is going, what we're doing, and English proficiency is useful. It's not everything. And so I believe that you have high abilities to communicate in English, maybe not perfectly. Again, patients who do not speak Thai and can best communicate with English language care mostly about your proficiency as a medical doctor more than your proficiency with language here. English language. So I wouldn't worry too much about being perfect. There are workarounds also. There are translation apps, and many hospitals in Thailand have staff that might be proficient in English language. A hospital that I go to for dental treatment, Yanhi Hospital, has many assistants from the Philippines that are able to translate from Thai to English. All right, let's finish with this ankle sprain. Suspected fracture. Based on your symptoms and exam, fracture is possible. We'll need an X-ray. Okay, ankle sprain. This looks like an ankle sprain. The ligaments are stretched. Treatment: rest, ice, compression, elevation. If you cannot bear weight, we'll do an X-ray and rule out a fracture. Knee injury, shoulder dislocation. Procedures: consent, safety. The main risks include bleeding, infection, nerve or vessel injury, and incomplete reduction. If you agree, please sign the consent form. Please do not eat or drink for now in case we need sedation or surgery. cast, splint, care, elevate the limb above the heart level for the first 24 to 48 hours. Keep the cast, splint clean and dry. Move your fingers regularly to prevent stiffness. Come back immediately if you have worsening pain, numbness, increasing swelling, or the fingers or toes turn pale or blue. Do not put objects inside the cast to scratch your skin. Back pain. Most back pain improves with time and gentle activity. I need to ask about warning signs: fever, weight loss, cancer history, numbness around the groin, or trouble controlling urine or stool. If any of these occur, please return urgently. Again, with anything in medical conversations, there can be a variety of correct ways to say these. We can start with pain control and physical therapy. Imaging is not always needed right away. Okay, for the elderly, hip fracture, counseling, family conversation. The x-ray shows a hip fracture. In older adults, surgery is often the best option to help them sit, stand, and walk. Without surgery, complications like pneumonia, blood clots, pressure sores, and loss of mobility can occur. We will coordinate with anesthesia and medicine teams to assess surgical fitness. Do you have any questions or concerns I can clarify? All right, let's finish with a few. Wow, this is very extensive, and we are running out of time. All right, there's a few things that I wanted to get to today. Let's finish off with a few English expressions. This is likely an ankle sprain. Your x-ray is normal. We'll use a brace, pain control, and follow-up in 1 week. I'm worried about your circulation and nerves, so I need to check them again. Let me summarize to make sure we're on the same page. Can you repeat the plan in your own words? To confirm, give acetaminophen 500 milligrams by mouth now, then every 6 hours as needed. All right, more and more. All right, we'll get to the IELTS next time. This is a useful IELTS test, and the resources that I've shared with you have 3 or more IELTS tests that you could do on your own. They're extremely useful. Occasionally there's a few mistakes in there. Let's double check this PDF. All right, then. That'll do it for today. And I want to thank you for listening. Resources will be shared with you. Check the links, and there may be updates during the week. So I want to thank you for your attention. Don't forget to be confident with your English. I've enjoyed sharing with you, so we'll see you next time.